Hello everyone, I'm Shilpa Mohanan from the Academy of Online Radiology Education. I work at University of Arkansas for Medical Sciences at Little Rock, Arkansas. Today I have a few interesting articles for you, and before that I would like to thank our senior editors Dr. Avnish Chabra, Dr. Kedar Jambegar and Dr. Manikam Nix Kumaravel for their contributions to this blog. Our first article is Evolving Role of Dual Energy CT in the Clinical Workup of Gout, a retrospective study. It's a retrospective study in 100 consecutive adult patients who underwent dual energy CT to evaluate for gout in each of two periods of time, that is one beginning in the March 2013 and one beginning in September 2019. When DECT examinations performed for gout in 2013 and 2019 were compared, the frequency of equivocal interpretations was significantly lower in 2019, possibly in relation to interval technological improvements. Negative examinations were less frequently followed by joint aspirations in 2019, possibly reflecting increasing clinical acceptance of dual energy CT results. Our next article is Utility of Preoperative Shear Wave Elastography of the Supraspinatus muscle for predicting successful rotator cuff repair, a prospective observational study with MRI correlation. This was published in AJR. It was a prospective study involving 74 patients who underwent rotator cuff repair between May 2019 and January 2021. The conclusion of the study was shear wave elastography derived elasticity is higher in patients with insufficient rotator cuff repair. The elasticity ratio predicts insufficient repair independent of tear size and muscle characteristics. Preoperative shear wave elastography may serve as a prognostic marker in patients with rotator cuff tear. Next article is Image Quality and Diagnostic Performance of Accelerated Shoulder MRI with Deep Learning Based Reconstruction. This was also published in AJR. It was also a retrospective study including 105 patients who underwent a total of 110 3 Tesla shoulder MRI examinations. Accelerated sequences with deep learning based reconstruction provide 67% scan time reduction with similar subjective image quality, artifacts, and diagnostic performance to standard sequences. So, accelerated sequences with DLR may provide an alternative to standard sequences for clinical shoulder MRI. Our next article is Examining the bone bruise pattern in multiligament knee injuries with peroneal nerve injury. This was published in American Journal of Sports Medicine. This was also a retrospective study including 123 patients who were treated for an acute multiligament knee injury at a level 1 trauma center between January 2001 and March 2021. The conclusion was the presence of a grade 3 posterolateral corner injury had the greatest association with common peroneal nerve injury. Additionally, anteromedial femoral condyle bone bruising on MRI was a highly sensitive finding that was significantly correlated with common peroneal nerve injury on physical examination. The high prevalence of grade 3 posterolateral corner injuries and anteromedial tibiofemoral bone bruising suggests that these multiligament knee injuries with common peroneal nerve injuries most commonly occurred from a hyperextension varus mechanism caused by a high energy blow to the anteromedial knee. Our next article is Diffusion Tensor Imaging of the Knee to Predict Childhood Growth. This was published in the journal Radiology. This was a retrospective study. Femoral DTI studies of healthy children who underwent MRI of the knee between February 2012 and December 2016 were retrospectively analyzed. The conclusion was models using tract volume derived from diffusion tensor imaging may perform better than bone age based models in children for the prediction of height velocity and total height gain. Improving radiographic fracture recognition performance and efficiency using artificial intelligence. This was also published in Radiology. This was a retrospective study, and this study used the multi-reader, multi-case methodology based on an external multi-center data set of 480 examinations with at least 60 examinations per body region. So the conclusion was artificial intelligence assistance improved the sensitivity and may even improve the specificity of fracture detection by radiologists and non-radiologists without lengthening the reading time. Psoas muscle index is related to hip fracture in osteoporosis, a cross-sectional MRI study. This was published in Skeletal Radiology. It was a retrospective study including 177 patients with osteoporosis, of which 105 were females and who had received lumbar spine MRI and dual energy X-ray absorptiometry. The conclusion of the study was psoas muscle thickness, cross-sectional area, and psoas muscle index might be associated with hip fracture in osteoporotic patients. However, this association is independent of bone mineral density. Psoas muscle features including PMT, CSA, and PMI should be used as significant predictors of falls and fractures in osteoporotic patients. Percutaneous CT-guided corticosteroid injection for the treatment of osseous Langerhans cell histiocytosis, a 3-institution retrospective analysis. This was published in Skeletal Radiology. It was a retrospective study including 40 corticosteroid injections performed in 36 patients. The conclusion was CT-guided corticosteroid injection is a safe and effective treatment for LCH. Pain resolution was achieved in all patients and imaging did not show progressive disease in any of the patients. The final article for this month is by one of our senior editors, Dr. Chabra. Neuropathy Score Reporting and Data System, a reporting guideline for MRI of peripheral neuropathy with a multi-center validation study. This was published in AJR. It was a retrospective study, and 100 patients with nerve imaging studies and known clinical diagnoses were included in the study. The experts crafted NS-RADS using mutually agreed on qualitative criteria for the classification and grading of peripheral neuropathy. Different classes were created to account for the spectrum of underlying pathologies like unremarkable, injury, neoplasia, entrapment, diffuse neuropathy, not otherwise specified, and post-intervention state. Subclasses were established to describe the severity or extent of the lesions. The proposed NS-RADS classification is accurate and reliable across different reader experience levels and a spectrum of peripheral nerve conditions. So NS-RADS can be used as a standardized guideline for reporting peripheral neuropathy and improved multidisciplinary communications. So that's all I have for this month. Thank you very much for listening. For more details, you can refer to our blog where we have given the links to these individual articles. Thank you very much.